So good morning. Welcome to our remote, I'm going to lose my voice now, ARC Northwest Coast Festival. This is to replace the one we were supposed to have last month, but cancelled because of the pandemic. I see I'm the only one wearing a headset, but Gareth had asked us to wear a headset because the quality is better, apparently. Sorry, I seem to be losing my voice here, which is perfectly timed. So you may have noticed, the sharp-eyed amongst you, that the timings that were sent out slightly wrong. We're starting at 10:30, not 10. So if you can stay till nearer 12:30, that would be easier. But we will try and compact our timings. Also, to let you know that we are recording this meeting. So if that's a problem for you, just to warn you that we are recording so that we can keep notes of what people say. Please make use of the chat function on the right-hand side of the screen. So if you double-click that on the bottom of the screen, that will enable you to pose questions, and that's where we'll be looking for questions that people want to ask after the presentations. I'm going to be introducing the panel members to speak about what we're doing. And they're going to do brief presentations on some of them with video, some of them will be live. And please use the chat function to pose questions. We'll have a couple of minutes, literally a couple of minutes at the end of a presentation to deal with questions. And those that we can't deal with at the time, we will follow up with afterwards and get back to people from the chat on the right-hand side. So please say who you are on the chat. I've also been asked to raise your awareness about the fact that Liverpool Health Partners and the universities in Liverpool are applying for a biomedical research centre, which we think is still going to be next year, but the timetable may be put back. And that's focusing on infection. So please watch this space for that bid coming your way, and we'll be asking for people to participate in that and contribute to it. And it will be featuring in our next newsletter. So, I don't know why this has happened this morning. I was fine up for that until today. So where are we up to? In terms of the ARC, as you may have noticed, we've been very busy with the pandemic, and although some of our work is carrying on, a lot of the work we're doing has moved towards supporting the pandemic research program. And we'll be continuing to do that for the coming months and year as we start to do the vaccinations as well. I've been on a call about that this morning. And thank you for your patience and cooperation through these difficult times for all of us in health and social care, and in terms of keeping the ARC ticking over and maintaining our contribution towards the pandemic research programs. So today we're going to be offering you a flavour of the work that we're doing both for the pandemic and for the ARC in general. And as I said, we'll do our best to answer any questions. In terms of the ARC itself, many of you will be aware that we were funded subject to a one end-of-year review, and because of the pandemic, that review has been put back to April next year. And we're funded, therefore, until the end of September next year for definite. But I'm very confident that with the work we've been doing to adapt and develop the ARC, that we will be funded through to 2024. So I'm confident about that. And I hope that despite the pressures of the pandemic on your organisations, you'll continue to be fully active members of the ARC as we continue to deliver a very exciting research programme. And I'm going to ask Ben to start us off talking about his theme.
Great. Okay. Well, I'll just see if I can share my screen, hopefully. Let me just see if this works. Can you see the screen fine? Is that good? Okay, well, thank you everyone, and welcome to this Art North West Coast webinar. As Mark said, I'm Ben Barr. I'm a professor in public health at Liverpool. Now I'm going to start losing my voice as well now. And I lead the Improving Population Health theme. So yeah, it seems like a long time ago since February when we had the last ARC Fest, and who would have thought that so much would have changed in just a few months. So I'm going to give a bit of a flavour of what we've been doing in the Improving Population Health theme, and some of those things we've had to kind of adapt to the current crisis, and some other kind of additional work that we've put in place to address issues that have been raised locally in relation to the COVID-19 response. So just a quick reminder of kind of what the Improving Population Health theme is aiming to do, and essentially we're looking at trying to expand effective local public health action, particularly on the determinants of health and health inequalities, and building capacity for evaluation of those public health actions. So we have a series of kind of data resources that's linked to the care and health informatics theme. Two main kind of resources that we've been using so far is the place-based longitudinal data resource, which is a set of small area indicators that we've been developing to sort of track health and the determinants of health over time in sort of small neighborhoods, and also some sort of linked data sets that we have, particularly for Liverpool at the moment, but that's potentially expanding, linked individual level data sets that I think Sarah's going to talk a bit more about, that we're also using to support this evaluation work. And then the theme really is a sort of portfolio of projects that are using these data resources and other research methods to evaluate and model and support the implementation of different public health actions across the Northwest Coast. So we've got a sort of series of projects that are in various stages of development. I'm not going to go through all of them, but I'll just focus on the first 4 of those. The work that we're doing to evaluate air quality improvement actions across the Northwest, the Ways to Wellbeing project, which is trying to integrate support for economic and social support into healthcare services. Work we're doing to assess the impact of economic strategies on health and well-being, and some specific work we've been doing in relation to COVID-19 around vulnerability of different places to the pandemic. So just on the first of those, various actions have been taking place across the Northwest Coast over the sort of recent years to try and improve air quality. A lot of these have been in relation to what are called air quality management areas. Essentially, if an area is identified as having problems with air quality, it gets designated as an air quality management area, and the local authority has to put together a kind of plan of how they're going to address that. So the initial work that we've been doing on that is mapping where these different air quality management areas are and what's been included in local plans. So across the Northwest West Coast, we've identified those areas and mapped across what kinds of interventions have been put in place in each of those places and when were they put in place. So that could be things around like traffic management or green infrastructure, cycling and walking infrastructure. And we're doing that work together with the equitable place based health and care theme, who are also looking at similar issues, in particular how communities have been involved in informing those activities, and some review work of how communities have been involved in air quality management. And the next steps on that are some initial work to evaluate what's been the impact of these different interventions across the Northwest Coast on air quality, and working with a few demonstrator sites to develop a more in-depth research project with the EPIC theme, developing their implementation and evaluating that. Obviously, one of the things that's been quite a good intervention for air quality has been having a pandemic. It has improved air quality as people have locked down. But as we come out of that, there's one of the issues is how we kind of maintain some of those benefits whilst restarting the economy, as people say. The second thing is on the Ways to Wellbeing project. So it's a project with Liverpool CCG, and they are looking at trying to integrate within health services support and advice for people facing kind of financial and social hardships, and that's working with citizens' advice. So citizens' advice managers kind of liaise with local services, encourage them to identify people at risk and refer them for support, and then they provide sort of rapid support and advice on things like welfare benefits and to help them kind of tackle poverty, and also put them in touch with other services within the community. And this has become kind of even more important in the current crisis, with a massive increase in people in receipt of welfare benefits because of the COVID-19 crisis, and the whole benefit system has changed quite dramatically, meaning that there's even more need for people to have that support and advice, as there's lots of groups are at increased risk of poverty. That service started in primary care a few years ago, and now they've received some funding to expand that across perinatal services. So supporting, ensuring the mothers that where they come in contact with services are given kind of rapid access to the scheme. And so we're supporting the evaluation of that, both in a sort of action research, so in real time, looking at how we can learn from what's happening at the moment to adapt the service to better meet people's needs, as well as over a longer term, assessing the impact of the service on health and well-being. And part of that at the moment has been looking at some sort of specific case studies, and then looking at the kinds of points where people have had access to services where they could be given better support, so we could adapt that service to ensure that people have the support they need at the right time and as early as possible. So over the next few years, we'll be evaluating the impact of that, and we have secured some funding from the Health Foundation, but also have applied for an additional grant from the National Institute of Health Research. So the third area that we're looking at is looking at supporting the kind of economic plans of the city region in Liverpool that we've been working with, but also councils and local economic partnerships across the Northwest Coast, to try and support them in ensuring that their economic strategies maximize the benefits for health and well-being. We know that there's this huge relationship between the economy and people's health, and now that we're entering a recession, there's potentially huge negative impacts on people's health. As a result of that, as a result of unemployment and the work that people are able to do, so there's a urgent need to understand what actions people can take to mitigate some of those issues. So we've been doing some work with Liverpool City Region, but also particularly we have a project developing a work with Preston City Council that have, over a number of years, have been implementing this particularly innovative approach to their economic development, which is really about ensuring that the big public institutions and not-for-profit institutions within Preston can use their kind of influence to try and improve the local economy. So that's things like the NHS, but also local authorities and universities, how they spend their money when they're procuring services. So when the hospital's buying in catering services, can they do that in a way that's going to benefit the local economy, and also supporting the development of kind of local enterprises like cooperatives, social enterprises and charities that are potentially more accountable to the local population and have a better impact. Looking at investing local wealth, like the local government pension fund, where in Preston they've invested some of that in providing more affordable housing, and the kind of employment conditions of those institutions and their suppliers, trying to improve that. And Preston was one of the earliest places to implement a living wage, so ensuring that many of the organisations in Preston ensure that people are paid a decent salary, and generally are better at that than other places. So we're working with Preston, and we've put in a grant with Preston City Council, put in a bid for research funding with Preston City Council to evaluate the effect of these actions on people's health and well-being, and in particular how that, in terms of the recovery from the COVID-19 crisis, how some of those actions can help mitigate some of the negative effects of current economic crisis. And finally, there's work that we've been doing focused specifically on COVID-19, looking at which places across the country are particularly vulnerable to the effects of the pandemic. So looking at some of the factors that are associated with mortality and how they're clustered within particular areas. And as part of that, we've developed a small area vulnerability index. And I'll see if I can, I know you probably can't see that, can you? Because I'm just, so I was going to see if I could show you the thing online, but I think I'm only sharing the PowerPoint slides. So, but basically we've got a small area measure that looks at 4 areas of vulnerability related to the age of the population, but also whether the prevalence of the proportion of the population that have kind of long-term conditions, the extent to which people, what proportion of the population are living in care homes that come from Black and ethnic minority groups or live in overcrowded housing, to identify those areas that are most vulnerable to the effects. And that index has been used by local governments across the Northwest in their actions to plan how they protect people and those communities from, in the sort of initial wave, but also in potentially a second wave of the pandemic, which may well be coming. So that's just to give a flavour of some of the activities that we've been involved with recently. And that's kind of the plans for the future is looking at expanding the opportunities to share learning from those projects across the Northwest, and also getting more member and public engagement in those projects, as well as identifying future priorities, particularly in relation to supporting the kind of post-COVID recovery, and further work to develop the capacity with members for evaluation and implementation. So that's where we're up to, and if there have been questions posted in the chat, I will try and answer some of those.
There have, but I don't think it's something that we need to deal with right now, Ben, because we're quite a bit over time. There's a couple of questions, one from Jane Cloak about traffic and the opportunities the pandemic offers us, and I think that's more of a comment than a question. And I think similarly, Tim's is more of a comment about the whole issues around public health and what's happening to it, and what we as an ARC perhaps should be acting as advocates for with government when we get the opportunity. So thanks very much, Ben. I should have said, by the way, it's not the chat function that you should be using, it's the Q&A that we should be using. Nevin's asked a question about physical activity during COVID-19 and the impacts on that future activity. Again, I think we take that as a comment, Nevin, as we will Tim's next point. So I'm going to move us on, if you don't mind, to Tony Marsons, who can't be with us this morning himself, but he's made a video which Gareth is going to put up on the system now for us. Which we can't hear. Gareth, can I leave you to sort that out and get Emma Halliday to come on instead? Is that all right? Give you one more chance to get it to work, or do you want to, if you want, or we'll go to Emma?
Yeah, sorry about that. 1 second, just try it again.
Running like clockwork, as usual, I'm pleased to see. Okay, I can't lip read, so I'll let you play with that. And can I invite Emma Halliday, please, then?
Sure, that's fine.
Hi, Emma. Sorry to throw you like that.
No, you're fine. Let me just share my screen.
Do you want to introduce yourself as well, Emma, when you...
Yeah, of course, yeah. Okay, hi everyone. I'm Emma Halliday. I'm a senior research fellow based with the Equitable Place-Based Health and Care theme, and the theme's led by Catherine Walsh, who's based at Lancaster University. So yeah, I'll just, before I get going, I'll just briefly sort of update people, or I'll give some background to the theme very briefly. So the themes have emerged, came from the, built on the work of the Clark's Neighbourhood Resilience Programme, which is funded in Neighbourhood for Learnings across the Northwest. And that programme, as many people know, sort of concluded with Clark, and the EPICS works evolved in new ways. However, principles of how the theme work remain the same, particularly in the kind of collaborations it wants to build with public, local stakeholders and researchers in conducting the studies. And as a team, we also have a particular focus on researching actions related to improving the social, economic and physical conditions, the social determinants of health. And into ARC, we've also been interested in starting to explore the research around models of integrated health and care. So in the remaining slides, I'm just going to give you a couple of examples of what we've been up to since the last ArcFest in February. Firstly, some work directly related to COVID, and also some work which is more reflective of our work on social determinants of health. So the first project to talk about is a diary project which involved members of ARC, who were public advisors in the ARC, who took part in a remote diary study over 8 weeks, which came to, in terms of the data collection, came to an end just a few weeks ago. And the aim of the project very much was about gathering people's experiences on the ground of the pandemic in their local communities, but also getting insights about how that was affecting people's health and quality of life during lockdown. And then thirdly, we're also interested, because public advisors have a lot of experience of conducting research, in what the experience was like of conducting a diary project remotely and online. So we've just come to an end in terms of the data collection, and that's generated quite a lot of data, so really rich insights about people's experiences. And we're now moving on to look at the following key topics listed on the slide. So firstly, looking at the effects on people's mental well-being during this time. So obviously sort of issues for everyone in terms of the experience of being socially separated from friends and family relations, but also additional stresses for particular groups, whether they're carers or people who have existing mental health problems, or other issues of living in households where you're sort of caring for children as well. We're also, as you might expect, to see sort of capturing the experiences of the lockdown rules and how that was implemented in communities, or how that was navigated, for example, in the sort of social distancing that took place in out and about in the community, going to the shops. But also interestingly, this period of the research covered the changes in those guidelines, which came in. So people have sort of reflected a lot about the confusion and challenges of that time as well, and how to understand it. And thirdly, people have written sort of very candidly about their sort of health and care experiences. So trying to navigate existing health services for their health conditions and what that's been like. Fourthly, people's experiences of technology, the method of communication for work or for volunteering or for socializing, and the benefits and the challenges. And as I've mentioned, the perspective on the diaries as well. So what that's been like from the perspectives of the people taking part and also the researchers. Then the second project is the work that Ben's already introduced in his slides, and the work on sort of air quality, which is important obviously in this region because of its differential impact on disadvantaged communities. So our perspective in EPIC is to focus very much on looking at the role of community engagement in strengthening local authority air quality plans and actions. And we feel this is important because we know from existing research that where communities are more sort of significantly engaged in decision making about issues affecting their neighbourhoods, this has a positive impact both for services but also individuals and local populations. So I think Mark has mentioned that there's further information on the website which talks about this work and also the diary work, so you can find out more there. But as Ben said, perhaps one of the highlights is the review of international evidence that colleagues Fiona and then Hayley from the ARC impact team are undertaking, looking at community engagement and air quality across different settings and countries. Then finally, to conclude, we'll be obviously looking to sort of plan and develop our longer term research. Some of that relates to work we were already thinking about before the pandemic around social prescribing. We're currently exploring a research idea focused on non-statutory or community responses to COVID-19 in terms of the immediate crisis period and aftermath, and also interested in the economics of that as well. And then finally, thinking about sort of future priorities for year 2 and beyond. And particularly interested to hear from people who have interests in integrated health and care. So thank you, that's me, Mark.
Great. I'm looking on, I can't see any other questions, as they all seem to have gone through. No new questions from anybody. So Gareth, can you tell us, that's really helpful, thank you Emma, it's lots of very interesting work going on there and very active, and I'm aware that we're continuing to develop work with neighbourhoods across the ARC, looking at coastal communities calls for research grants, etc., and looking at how we can continue to build on the excellent work you've been doing in the neighbourhoods for learning and what we call corons. Gareth, is that Tony Marson's presentation working now?
Yep, sorry about that. We should be okay this time.
Hello everyone, my name's Tony Marson. I'm the theme lead for the person-centred complex care theme in the North West Coast ARC. I'm sorry that I can't be with you in person, but you might not have spotted that if I hadn't told you, given that this is a Zoom meeting and I'm obviously preparing a Zoom meeting recording. I'm going to give some highlights of what we've got planned in the person-centered complex care theme over the next few months, and you'll be hearing from other members of the theme during the course of this meeting. I'm going to share a brief presentation with you. And what this presentation highlights is the output from the theme meeting that we had at the last ArcFest just before the lockdown. And we had a couple of hours meeting where we did a lot of table work with partners and the public represented, and it was great to see that there was a high degree of convergence around a number of important themes that we need to pursue in terms of developing grants, and also around projects for implementation. And what's really important, I think, is that we identify programs of work that we can deliver rather than lots of small projects, which I think we will struggle to bring cohesion across our patch if our focus is on a number of small projects. So one of the areas that was identified was around digital healthcare, and of course there's massive investment in terms of providing digital systems in hospitals, primary care and social care. And what's lacking often is an integration of those data, both for providing face-to-face and direct care, but also in pulling those data sources together for better research to tell us how well care is being provided, but also think about how we plan care and also do some more blue skies research. So there's lots that we can do in this realm of integrating data. And one recent example of that is our Civic Data Cooperative that's been funded in Liverpool. And I'm so sure that Sarah Rogers and the team will be telling you much more about their endeavours in terms of data and the health informatics theme within the North West Coast ARC. Linked to that was the need for care plans and the need for those care plans to be integrated into these digital health systems, and that's particularly important for people with complex needs for their care and people with multiple conditions, as we'll come on to in a couple of minutes. Also highlighted the need for individuals to actually have greater access to their records, but also to be the holder of those records and to have them available to them in a mobile and digital form. And also people need access to those records and the ability to input data into them, and often that's not made available. And also linked to that, and then very relevant to what we're experiencing now, is the need for virtual and remote consultations, and particularly, for example, for specialist care, where people might need to travel long distances for what are relatively short appointments with specialists, and much of that can be provided virtually. But we're all experiencing probably virtual overload in this Zoom-dominated meetings culture, and clearly there are pros and cons to virtual and digital consultations, and there's also a risk in terms of widening health inequalities, as those with the greatest need might health-wise might have least access to the digital means to access these consultations. The second area of priority was around multimorbidity, and this is where people have multiple medical conditions, be they physical or mental health problems. And there's much work that we need to do on our patch to understand the trends in multimorbidity, and to understand where are the hotspots and what are the particular multimorbidity problems that we need to tackle in the North West Coast. And linked to this are problems with accessibility and equity of care. And there are a number of vulnerable populations on our Northwest Coast footprint. And again, we need to be able to better identify who they are and where they are. For example, those in care homes who've suffered so greatly during the COVID-19 crisis, as there's been a major problem with the coordination of efforts between health and social care. And we've also highlighted the problem with continuity of care, and that's clearly an important problem that needs to be addressed. The third area that was identified was around models of care, and models of care are changing, and we have integrated care systems which are being developed almost on what was previously a regional health authority footprint, and I guess what goes around comes around. But there are changes that are being made into the way that organisations are being brought together on both the Mersey and Cheshire footprint and on the Lancashire and South Cumbria footprint. And we have primary care networks that are evolving. And we also need to think about care coordinators. And one thing that's become obvious in some of the work that I've been doing with NHS England around developing care pathways for people with neurological conditions is the primary importance of a care coordinator and that single point of care for point of access for people with neurological and conditions, which is highly relevant to anyone with complex needs and multimorbidity. What I think is vital, as I said earlier, is that we identify those programs of work that we need to do. And I think there's a substantial risk if we focus on a plethora of small projects that don't bring together the whole. So I'm very keen that through the person-centered complex care theme that we identify programs of work that will unify our focus and bring together our partners and critical mass with a degree of unity. And of course, our aim is to tackle the health inequalities that we have on our patch, and it's really important that we really make an important difference. So we continue to have a massive challenge. I think the challenges are going to be greater, but the opportunity is also greater in this post-COVID era. Okay, and thank you for listening, and I hope that you enjoy the rest of the meeting.
I hope we're not going to get the CNN on there. So just looking through the chat, I see that Jenny Downing has answered Dorcas's question about remote consultations. And indeed, there's a lot of work happening in general practice in various ways. I think one of the issues there is that government seems quite keen that we do more and more remote consultations, but as an ARC, we're very keen to look at the advantages and disadvantages of that, whether we can identify where it works better, where it doesn't work so well. So thanks for that very important debate that will be going on for some time. There's a comment there from Tony Gattrell about duplication. I think, Tony, the answer I can give as a director is that we're regularly in communication across the ARCs about what work we're all doing. We have a very substantial document where we've identified the work that we're doing and planning, so that we look at that first before we set up something new and try and make sure we're maximizing the potential to integrate and collaborate. So hopefully that's addressed the questions I can see on the Q&A there. I'm going to move us now on to Selena. Selena Wallace, if you want to introduce yourself and then do your presentation, that would be great.
Yeah, you can hear me? Yeah?
Yeah, we can hear you.
Okay, brilliant. Thanks, Mark. So thank you, Mark. And I just want to introduce myself. So I am Selena Wallace, and I am the new Public and Community Involvement and Engagement Manager for ARC Northwest Coast. So it's been a really interesting experience getting a new role in lockdown. So I'm lucky enough that I was already working at the University of Liverpool, so I've met a few of the ARC staff in real life, but most of the people that I'm now working with, including all the public advisors, I've only been meeting virtually. So that's been a really different experience of getting a new role. And my own background, I've been working in public health for about the past 15 years, right across the Merseyside region, and across lots and lots of different aspects of public health. But if you take me back 15 years to before all that, I was a secondary school science teacher. And my own background was as a lay member, as a public advisor at the Women's Hospital, and then also working with the Nursing and Midwifery Council. So I'm really, really passionate about public involvement and in research. And it's really, really exciting to be back and working within that. Within the ARC, and I'm really lucky that the ARC itself has obviously been running as a clerk. So this is my team. We've got Ruth Ball, who's our administrator for public advisors, myself, who's going to be the public involvement manager, and Dr. Lucy Frith, who's our academic lead. So we're all working together with a huge team of really inspiring and dedicated public advisors. So I've been in the role now for about 6 weeks, and I have been mainly sort of talking to people via Zoom interviews. So that's all the theme managers, the theme leads, but also having one-to-one with all the public advisors, because for me the most important thing is seeing how things have been working, both in the clerk and in the last 6 months of the ARC, what people have been doing, how people get involved in the research, and what is working really, really well, and how we're going to make it really fit for purpose, and make sure that all the public advisors and the communities across the Northwest Coast are able to really have a voice. And I've been really inspired by the way that all the researchers and the governance of Northwest ARC involve the public. Personally, I've never seen a research collaboration, even across all the ones that I've worked with, have this much, co-production and involvement already. So it's really inspiring for me to be able to see that. This is just a little reminder. Obviously, you all know this very well about sort of what it is that the ARC is trying to do. But the important thing is to hear people's stories and understand how inequality affects people actually living across the Northwest Coast. And talking to all the public advisors one-to-one has really given me a sort of an insight into what it's like for individuals living in lockdown and living with COVID, but also how important being a public advisor is to them. People's stories about, even being totally shielded, vulnerable, unable to leave the home, but still able to really get involved with the ARC, to get involved in research, and to get involved in thinking about the best kind of research that's going to actually look at reducing inequalities and understanding the effect of COVID on people in lockdown. Really, really important. So one of the first things that I've been doing is just having a look at who our advisors are, where do they live, how many have we got? Because obviously I was lucky enough to already have a big group of really experienced advisors. So I've just been looking at sort of a breakdown of our advisors. So at the moment, the ARC Northwest Coast got approximately 50. I think we've got a couple more starting up in the last couple of weeks. So we've got around 50 to 55 advisors, and about 32 of those have been active in the last sort of 6 months of ARC. We've got quite a good breakdown around sex and gender, around a 50-50 split. We've got 21% BAME members that are public advisors, and I've spoken to, I think, 20 out of those 53 face-to-face on a Zoom, and I've worked out that we have got over 2,500 years worth of life experience within our public advisors. So I think it's an amazing resource, both for the researchers within ARC, but also the members to access, to understand about what it's like to live around the Northwest Coast, and to make sure that the research that people are doing is really going to work for people and get that understanding of how it's going to affect people's lives. So one of the things we're going to look at, so our sort of future plans around recruitment are sort of looking at whether there's any missing demographics. You can see from the map that quite a lot of our advisors around the sort of Merseyside region. So we're going to sort of look at recruiting around the north, South Cumbria, Lancashire, and also look at those sort of seldom heard groups as well, and working really closely with third sector and the member organisations to look at recruiting those and how to get in touch with people that we're not maybe hearing from. This is just a really quick breakdown looking at sort of the public advisor work across the ARC over the last 6 months. So the blue columns are those that were working sort of January to March, and the orange are April to June. And then on the left hand side, obviously you've got the different themes within the ARC. And obviously the COVID work has all been in the last sort of 3 months in the spring. So I'm looking at sort of the numbers of advisors involved. And about just over a week ago, we had a virtual public advisor forum, which was really, really well attended. I think we had about 26 of the public advisors involved. It was really, really interactive. Everyone got a chance to talk about the work that they've been doing in the themes, in the subgroup. So looking at things like governance, getting involved with the steering group, getting involved with communications, and particular research projects. But also hearing about people's stories about what has it actually been like for them living in this situation, and what work have they been doing in the communities. Really, really inspiring stories about people's work in the communities. If you look at the bottom picture, that's just a little word cloud that we created at the end of the session about how people felt after that virtual forum. So, and obviously you can see the biggest word down there is proud. So the public advisors are just, you know, really see the work of the ARC as you know, really important to them. This is a bit of a diagram about the ways in which public advisors are involved across the North West Coast, and about some of our ideas about the future and what we're going to be doing around public involvement. So one of the first things that we need to do as a group is to co-produce a strategy around public and community involvement for the ARC. So that's one of the first things that we're going to be doing, is setting up a subgroup for public advisors to work on that with us. We've also got a sort of a number of other ideas. So I talked very briefly about recruitment and getting a few more advisors involved. But I also want those advisors that have been working with us for a long time, who are, you know, have been involved right from the beginning from Clark, to be able to offer their experience to new advisors that sign up. So, you know, pairing them up together, getting some buddying and mentoring going, so that people feel confident as they start as a new advisor about what they're doing. We also want to get more involved with the different communities around the North West Coast, look at maybe community of practice around, or with yourselves, the member organisations, around what already is happening around public involvement. We've talked to people like the Innovation Agency and the other local ARCs about this. And also, I'd like the public advisors to get closer links to member organisations in their areas, so that we can start to look at the research pipeline and about prioritising, looking at the data and making sure that that lived experience is really linked between the members and the organisations. And another idea that we're looking at is maybe setting up a bit of a panel. At the moment, public advisors are involved in theme groups, but also in research projects in quite an in-depth way. So maybe a couple of them involved right from the start, from research proposal sort of stage all the way through. But we'd also like to have a panel which will give a more immediate feedback. So that would be a bigger group. So maybe 15, 20, 25 people, where members and researchers can come and sort of talk about their initial ideas and theories, and so that they can get more immediate feedback from a bigger group of public advisors, as well as the more in-depth work on each research project. We want to look at training, so I'm talking to MISUS and the health and care informatics teams about looking at the training of public advisors as well as the member organisations. And the last thing that I want to talk about really briefly is making sure that we look at evaluation of public advisor impact on the research and on the art itself. You know, it's so important that we look at not just how people are involved, but what kind of effect that is having. So we want to start using a tool called GRIP2, which will be used a bit like the HIAT to really understand how are public advisors involved, at what stages, and in what difference does that make, what change does that make, and that will also be published in the research papers. So I'm going to be doing some training on that with all the researchers as well. So I'm going to be emailing out to all the members, all the link members, about what we're hoping to do, so that I can also get some feedback from you about the public involvement you have in your organisations and how we can get more involved in those sort of cross linkages. So thank you everyone, and I look forward to working with you.
Hi, thanks, great. Just trying to keep up to time, but can you answer that question from Mark? What's the timeline for the strategy, please, Selina? Is there a target date for completion?
Yeah, so I think it needs to be actually sort of submitted as a final document in March to the NIHR. So obviously we're going to be having a draft document well before that, so we can get comments out to everybody.
Great, thank you very much. Nahid?
I'm just going to stop sharing my screen.
Nahid is going to do hers now. If you want to get your, are you going to be doing a presentation or?
Yeah, okay. Thank you, Selina. As co-chair of the Public Advisor Forum, may I take this opportunity to welcome you formally to ARC North West Coast as our new Public Advisor Manager. In a very short space of time, Selina has managed to connect with a lot of us personally in some way or other. Her experience and enthusiasm to embed public advisors solidly in ARC is much appreciated. The public advisors would also like to thank Ruth Ball, our admin, who has not only been an immense support in lockdown, but been crucial in getting ARC project opportunities, finance forms, and virtual Zoom team links to us all. For the last few months, public advisors have had to not only get used to lockdown, but also to new and different online platforms of communication. This exciting technology has continued to give us a voice and bring the vast amount of lived experience of so many public advisors to the forefront. Since March, there was a lot of disappointment with cancelled meetings, missed training opportunities, and no ARCFest, to mention just a few. But this did not stop us. Public advisors have still been involved in numerous ARC themes, projects, activities, and community work. They have managed to achieve some great stuff and produce brilliant pieces of written work. Despite being at home, as always, public advisors have still been able to contribute, interpret findings, and shape future research in ARC. Lockdown has brought out the soul in public advisors. This is why their contribution and involvement is so valued, is crucially important and vital to future ARC research. We had a successful Zoom forum meeting last week with more than 20 public advisors participating. We learned that, along with continued online meetings and input in governance and communication subgroups, many have been involved in COVID-related projects. These range from lockdown diaries, participating in focus groups, one-to-one interviews, coding, transcripts, self-organised discussions, and writing their own papers, with foundations laid right from the start for some public advisors who have been added as co-applicants on proposals. There have been numerous tweets and retweets on Twitter, stories published in local newspapers, radio interviews, and many helping their own local communities and neighbourhoods. The elderly and vulnerable with food parcels, shopping, PPE, befriending phone calls, as well as learning how to homeschool and supporting frontline workers by taking part in clapping every week. There have been those who have experienced COVID-19 virus, and sadly those who have lost loved ones. There have also been advisors who have been shielded completely or not ventured outdoors at all. My husband and eldest daughter, who are both frontline workers, have had to move to hotels for the last 3 months to minimise the risk for the rest of my family. My caring responsibilities, physical and mental well-being, was therefore tested because I had to look after my vulnerable special needs daughter on my own. But throughout this, one of the things that has kept me going was that I enjoyed and looked forward to using Zoom and continuously being involved in ARC research. One such project was with the BAME community. It was a real challenge because I had to gather people together for online focus groups, and for many, it was a completely new concept. But having the support of the project lead made it all that much easier, and I enjoyed teaching others and learning to co-facilitate in this new way. It was a great insight into the Muslim community and their perception and experience of COVID-19. I feel proud to be part of a diverse ARC team, where I have been involved in helping to tackle health inequalities and using research findings to improve health services. Before handing over to Alan, I would like to say that the virtual world for many public advisors has been a lifeline for their continued involvement and maintaining their work for ARC. Public advisors are breaking down barriers, and this technology is something we all hopefully will carry on utilising in the future, alongside conventional face-to-face meetings. Thank you. Over to you, Alan.
Right, well, thank you very much, Naheed. Back in March, there were so many things in the diary, as well as an art fest, a public advisors or PAs forum, etc. There was a conference on social prescribing in Preston that the PAs were looking forward to. I know I was, because it's something I really believe in. There were also 2 or 3 conferences in Liverpool, Manchester, and I think Leeds, where PAs who were members of the Health Inequality subgroup were going to speak as part of the launch of the Trainers project, which they've been working on at the University of Lancaster with Anna and Paula since last summer. 2 examples of the things that we've been doing on this project were a poster about health inequalities, showing real examples experienced by the PAs themselves in the group, and another that shows the pursuit of health equity. Both of these posters were co-produced, and both will be used as tools once things are back to normal. I believe they can be found in the ARC Northwest Coast YouTube site that Darren's been putting together, but if not, we'll make sure that he gets them and can put them in. I was hoping they were going to be in the pack today, but sadly they haven't got in there, but no matter. Now, they both have the Clark logo on them, but they're a real example of work within Clark, or that started within Clark, that has been carried on and further developed in ARC. PAs will still, I hope, be training the trainers and showing ARC members and prospective prospect applicants how to develop a health equity mainstreaming strategy, or HEMS, into their bids. The reason why I've mentioned this particular subgroup and I'm going on about it is because I think it's the contribution of the PAs within it, and because it's also an excellent example of how PAs bring added value to the work of the academics and the practitioners within the ARC Northwest Coast. Going forward, we're looking forward to recruiting more PAs from around the Northwest Coast area. There are many groups that can be contacted, like neighbourhood groups, local health watches, the voluntary sector, etc. And the existing PAs can help with this if required. But of course, new PAs need something to do. New projects from all around the area are needed. We need the member organisations to work with us to embed and embody the golden threads of public involvement, co-production, and of course, health equity. These are the foundation stones, the underlying values, if you like, of the work of our Northwest Coast. And I think I can speak for the majority of PAs, Mark, when I say that we'll be right there when lockdown restrictions are lifted, or even before then, to help get some real momentum up and running again. Thank you.
Thank you very much. Okay, I think there have been some comments coming up on the chat about other groups such as Commentus at UCLan supporting this work, and people very approving of what you've been saying. So thank you very much for that. Because of time, I'm going to move us up to the video from Sarah Rogers. Please keep an eye on the chat, by the way, because I'm continually, and I'm sure colleagues are continually answering those as they come up, but I'm also removing them as we deal with them, I think, and they'll appear later on in the notes from the meeting.
Good morning, everybody. My name is Sarah Rogers, and I'm the theme lead for the Care and Health Informatics. theme. And I am just going to give you a quick update on the work that we've been doing. So as you know, our team has been quite small. There's just been me really and Costas Darras, who's working half-time between the Care Health Informatics theme and the Improving Population Health theme. And Costas has been doing some great work on putting together mental health indices and COVID-19 vulnerability indices for the place-based longitudinal data resource, working with Ben Barr for the population health theme. And he's been using hospital episode statistics to look at the data that is created when you go into hospital and are admitted to hospital. And that's a really valuable resource because Costas has got access to the individual level data there. But some of you might not be aware that having access to the hospital data alone is very useful, but it isn't as useful as it could be, because ideally we would like your data linked with the data from your GP, the data when you go to outpatients, and other data such as the housing conditions or the air pollution in your area. And having those the ability to include those wider data sources and link them all together is what makes linked data really, really valuable. And we can understand the whole system and be able to work out what is going and where to intervene to improve health in our big systems. And so what is really exciting is that we've got two new members of the team, Ollie Butters and Becca Wilson, and they're joining us. They've joined us as of the 1st of June. Becca brings a fellowship with her that is from the Health Data Research UK. So majority of her time will be spent working on that at first, but we hope to integrate her into the team nevertheless. And her fellowship is got elements of data visualization in it, which is very helpful. And I'm sure in time I'll understand what she's doing exactly. Ollie is going to be working with us full time from, as I said, from the 1st of June. He's been working with us. And we've got plans together to create residential data links, and this is working with the Liverpool CCG. So we'll be able to include the variables such as air pollution and housing, and maybe even a special case of care homes, which would be very useful in terms of immediate COVID research. We hope to bring lots of linked data together for the region in something called the Civic Data Cooperative. And to be able to do this, it would be really helpful if we brought you all with us and helped you understand the immense benefits of having this linked data. And so to that end, we've got a couple of big data ambassadors who've joined us from the public advisors, who are Terry and Saika. So they've been really helpful in generating some material, and I think there's one page, A4 page, which will explain in more detail why we want you involved in this, because anything that we do with your data, it's your data, of course, and we want to bring you along on our journey, and we want to make sure that we don't do anything with your data that doesn't involve you, so nothing about you without you. So it'd be really good to have your confidence in us and to build your trust in the fact that we are able to hold your data securely, link it together so that it's all anonymized, it has your names and addresses removed, but trusted researchers such as myself and Costas and Ollie can look at the data and be able to work out collectively for the whole of the several million people in the Mersey and all the way up to the north of our region, all through the ARC region, that we can be able to create some really good research projects that have immediate operational impact, so we can improve services for you, and the way that the resources are spent in the region so they have the best impact on improving your health and well-being. So I'll finish off there because I've rambled long enough, but if anyone would like to get involved, please get in touch. And I know several of you put your name forward already for the public advisors who are interested in the big data. We want people who are knowledgeable about data in general, but we also want people who are less knowledgeable. So as I said, please get in touch, because we want a whole range of people involved to bring you with us on our journey to create this fantastic data resource for the region. So thank you very much for listening, and I'll look forward to hearing from you. Bye-bye.
Bye, thanks. Okay, I'll just see, I think there's one question on there. Question which isn't directly to do that. I've got 99 participants on my, it's on it's 100 now. Oh, down back to 99 again. It's on the bottom of the screen. You should be able to see how many people we are. I'll leave Ben to answer the question about HES data. Right, so thank you very much for that. Andy Clegg now, please, from Midas Theme Lead.
There we go. Can you see the screen?
Yes, we can. Yeah.
Lovely. My name's Andy Clegg. I'm the theme lead for the Midas theme. I'm from UCLan. And I'm just going to talk you through some sort of headlines of what we've been undertaking during the period from the start in October. Just the slides will be on the website, so if I zip through anything too quickly, you should be able to follow up, and you feel free to come back to us. That's just to show you who we are. It's a broad sort of methodological background to the team, with all the names there. So health economics, evidence synthesis, that sort of thing, health equity, and so on. To talk you through what we do, what our basis is, we're there to be a support across the applied research within the ARC Northwest Coast. So that's not just to the academic members, but across all the member organisations. And our work is split into these kind of areas. Research is all about helping people to put together applications and then to deliver that research. Training and education speaks for itself on all the different forms of methodologies that are out there. And we'll cover not just member organisations, but public advisors as well. Develop networks, because we want to leave a legacy after this ARC of setting up groups of people who have knowledge and expertise in the different methodologies out there, so it sustains into the long term. So methodological innovation, where we have to develop things because we can't use current methods, and then obviously to disseminate what we find and help people implement it, along with the impact theme within services to try and help develop those better. But underpinning all our work is health equity, consideration of health equity, involving patients and the public, co-production and capacity building. That should be through everything we do. So what have we achieved over the period since October? Well, we've been involved in, or members of the group have been involved in 20 applications that have gone in for about £3.6 million, and so far we've got 3. There is a fourth one which hasn't officially been announced, and there'll be more to come hopefully after that. A lot of our work has initially been spent producing systematic reviews. So this is producing reviews that have been brought up by different members of the ARC to try and answer questions that help them to develop their policies or practices within their organisations. So there's a range of them there. There are 11 reviews so far that we've been involved with, ranging from things like looking at how continuous quality improvement can be used, barriers and facilitators to different practices out there. So we've got one for deprescribing, another one associated with looking at social prescribing, and as well as the deprescribing one, and our COVID-related work, which is our current focus at the moment, which is looking at the prevalence of and interventions to manage psychological conditions. All of these have been brought up by different member organisations for us to help with. The last two looking at the implementation strategies for oral health interventions and the improvement collaboratives for stroke, all with the impact team. So the first two of those have been published, already completed and published, and those publications should be available on the website, and the other ones are moving towards finalisation and publication as well. Races has been a big part of our work over this period of time. These are all about taking evidence that is out there and finding it and summarising it in a critical way to answer questions that come up from the different member organisations. Part of it is giving them the evidence to help shape their practice, develop services, etc. But another element of it is training people in how to critically appraise and write short summaries of systematic reviews out there so that they can be used to inform practice. And we do that as collaborative. Members of the MIDAS group work with those individuals through the process. The intention being that we'll develop this and open it up across more member organisations as we develop and create communities of people who can routinely go about identifying, finding systematic review, relevant systematic reviews, summarising them, and then using that information to inform practice. All of those ones there have been undertaken with the different member organisations, and most of them have been there, excuse me, to answer specific questions they have. This also is involved in trying to develop, as I mentioned at the start, training and education programme. We had hoped to run a survey of all member organisations to find out what the training needs are around research methodology. We've developed the survey, but we've held off on sending it out just because of COVID taking up people's time. So that'll be launched in September and go to all member organisations. It'll go to the named contacts in those organisations and then be fed down through the organisation to all those people who have responsibility or an interest in research so that they can complete it. And then we can look to how we can help people to either identify courses that exist out there or provide some ourselves, some training ourselves. We've also been involved with, or members have been involved with Train the Trainers programme with public patient advisors during this period as well. Network development, which is the bit I mentioned about creating this network of people for, or groups of people to try and sustain the methodological advice going forward. We've identified, the first step we've done is to identify all those people who we feel have got the expertise in the 5 universities that are part of the ARC, and we're going to invite them to form these sub-themes, these groups from September onwards. Again, we've held off on that just because of COVID. So we'll be inviting people. The important thing is that we're starting with the universities because it's easy to identify those individuals, but then we're going to open it up to anyone, any member organisation to be part of those groups. And they'll develop both training, they'll have regular meetings to identify training needs, to undertake projects, and they'll basically run themselves in that process like mini themes. We've been collaborating across all the different important networks as well to try and feed into both their processes as well as to learn from them too. What have we produced in terms of dissemination? Well, the members of the group have produced 22 journal articles which have been published and been to a number of conferences and a number of other different types of ways of disseminating the results out there. And our next step is to make sure that all of the work that we do feeds into implementation plans within different organisations. Health inequalities is a central part of ARC and a central part of MIDAS, because MIDAS has responsibility for that. And we're working to produce a health equity mainstreaming strategy. And this will be working to endeavour to make sure that health equity is considered in all research, both in terms of applications and research conducted. And the strategy won't just be a strategy that's produced and sits on the shelf. We're working on ways in which we can engage people and help people work through in terms of how to encompass health equity within their research going forward. Finally, just looking at sort of opportunities that exist out there, which come from what I've spoken about before. We'll be inviting people to join the network. So if anyone has an interest in those, they should contact us. We'll be through the website, the ARC website, we'll be identifying the different sub-themes that we'll be inviting people to, and people should feel free to contact us. And the email's at the bottom of this slide if they have an interest in areas, all the different areas, statistics, evidence synthesis, health economics, behavioural science, etc. If you're interested in us helping you to produce a race, then just contact us, and we can program in helping you, guiding you through the process and developing skills and producing that race. All of those have been published so far. As I said before, the survey's going out in September, and if you're interested in working on the health equity mainstreaming strategy, please do feel to get in contact with us, because that's part of the process of broadening it out amongst the whole of the ARC membership and the public advisor forums as well. So we'll be going out to contact people, but if people are interested and know they have an interest in this, do feel free to contact us. And that's it.
Thank you very much. I can't see any specific answers to questions to Andy, but I noticed that we have from, which seems to have gone off my screen rather annoyingly, our health economist, Louis Philippe, and the team at Lancaster have kindly invited colleagues to contact them. So that's Bruce and Lewis if you need any health economic support for any ARC work. It's reappeared on my system again. Okay, so trying to keep up with time, it's me. So, right, let's see if I can share my screen. So I'm going to be quite brief. So I'm the theme lead. I'm Mark Gabay. I'm director of the ARC and theme lead for health and care across the life course. I noticed that Catherine Abbott has posed a question about social prescribing and is keen to restart the work that we were supporting before the pandemic hit around social prescribing, and has plans to relaunch the events that they were going to be doing until the pandemic and social distancing meant that we had to cancel it. So I'll leave Catherine to use the question and answer area to let people know about what we're hoping to do in the future. I'd like to welcome Clarissa Giebel, who's going to talk briefly shortly about her dementia work, who's our new research fellow, who was working with Midas but is now the research fellow on the health and care across the life course theme. We've been adapting some of the elements of the ARC work to the COVID-19 realities and the post-COVID-19. So Stephen Mason, who's a palliative care specialist, had a project within the ARC that we were developing around serious illness discussions around end of life. And they've been adapting that to specifically focus on COVID, and that work is being supported by Stephen and others. And he's been talking to NHS England about their proposals to widen the uptake of that particular approach. As I said, Catherine and Nadia have been looking at social prescribing, and it is a very moving feast. Joe Ryland, who works with me in Liverpool, he's an academic fellow trainee in general practice, is setting up a low-carb program in communities, and we've adopted that to support it alongside the ARC rather than as a formal ARC piece of work. But there was a Cochrane review we're going to do, which I think at the moment we feel that we don't have the resources to be able to continue to do for now at least. Although I think Joe, that's also Joe's piece of work, is talking to Andy Clegg about whether that has potential to be supported in the future. So a lot of the work of the theme and colleagues within the ARC has actually switched to specific COVID work. There was a relatively large grant made available within the Liverpool City region by a number of funding systems within the university, the local authority and Alder Hey charities. And we've been heavily involved across the ARC in a number of the social science and indeed the virology elements of that. And we've been recruiting households from that we were involved in our Clark survey to take part in the virology study looking at transmission of COVID, as well as a number of related studies. So Rhiannon Corcoran's been leading a household survey in depth, looking at a variety of areas of mental health and physical health and other factors and the impacts of COVID on 300 plus households that will be recruited to that study. I'm leading a project with colleagues in ARC looking at specific risks assessments and how both households and communities and local employers are responding to the risk posed by COVID in terms of transmission and the impact on other elements of the work they've been trying to develop within communities, the impacts on households and how they're able to make sense of the pandemic and the risk it poses to them and their health. And obviously in wider terms, not just the immediate term, and also discussions with local employers. And all of this work is about to get up and get going. Shema Hassan, who many of you will know from the work she was doing in Clark, has just completed the data collection for a specific piece of work looking at risk assessment within and responses in the Muslim community in Liverpool, and they're now undertaking data analysis. And Rhiannon and Clarissa will be talking more about the work they've been doing. You've heard something about the work Lucy's been doing with public advisors, Lucy Frith that is. She's also leading an area of work within the this overall program called COVID Live, looking at how the NHS is reacting and being changed by the pandemic. And Darren Charles, who, as many of you will know, is our communications lead. He's been working with academics in the university looking at fake news in social media and how formal organisations such as government respond to that fake news to try and correct misconceptions and misapprehensions that appear in Facebook and Twitter, etc. I don't want to dwell much longer on what we're doing, partly because I think it's my job to try and keep us to time. So I'm going to just check the chat function and see if anything's come through, and I will stop sharing my screen while I do that, so I can see that again. I see Catherine's responding about the social prescribing, and I think that's it. I can't see anything questions to me about health and care across the life course. I'll keep an eye open. So can I invite Rhiannon?
Yeah, hi everybody. I'm Rhiannon Corker. I'm a Professor of Psychology and Public Mental Health at the University of Liverpool. In Clark, I was leading the Improving Mental Health theme, and now I'm involved in a fair amount of mental health work in ARC. And as you can imagine, mental health and well-being is a really important topic currently in terms of sequelae of COVID. Today, I'm going to talk about a piece of work that we've been doing, as Mark introduced it, funded by a consortium of funders in the Liverpool City region, which is a household health survey, which began, as Mark was saying, collecting data from people who had been involved in the Clark household health survey, who lived within the city region. We've since widened recruitment into that survey, and I'd like to draw the attention of anybody who lives in the Liverpool City region to the link to the survey, which is live now, which you can fill in, please, if you like, to answer questions about the psychological and community impact of COVID-19. So the team who've been put in place to support this household health survey is pretty wide, actually, and I'm just mentioning a few people here. So Kate Bennett in psychology and I are leading it. Mark, of course, is involved. We have a really efficient researcher, PDRA, called Catalin Gomez, who's helping to run it on a daily basis. And Mark Goodall, who many of you will know, is being really, really helpful in getting the online surveys up and running for us. And as I said before, many other ARC researchers are involved in helping to recruit to this particular piece of work. Again, as most of you will know, the Liverpool City region has some of the most disadvantaged neighbourhoods in the country. And because of that, there are greater risks from COVID, and COVID restrictions can have much more of a negative impact on psychological and community well-being. So the aim of this particular household survey, in short, is to understand the psychological and social impact of COVID-19 on household members across what we hope is a representative range of neighbourhoods within Liverpool City region. Number of objectives listed on the slide here. So we're interested to assess the impacts of COVID-19, including differences between those who contract and who don't contract COVID-19 by neighbourhood disadvantage, to examine the impact of COVID-19 on individual well-being and on resilience, to assess changes in loneliness over time as a consequence of COVID-19, and of course loneliness is very important for our well-being and our mental health. And then with a more psychological focus, to examine how tolerance of uncertainty influences individual well-being. So we've all felt very uncertain during these times, and some of us have felt more uncertain about what's going to happen to their futures than others, for all the reasons that we now understand as a consequence of COVID. So we're really interested to have a look at that particular aspect of psychology, which differs between people. We want to examine the impact of sense of community on individual well-being in this particular household survey, because again, we all know that if we have a strong sense of community, then it makes us as individuals feel like we belong to something meaningful, and that improves our own well-being as well, indeed, as the well-being of the wider community. And to examine the individual, community and societal factors which promote or hinder resilience at an individual level during this time. The survey itself is running 3 times, and it is done by individuals over the course of 12 weeks, 3 times. We're currently still recruiting into survey 1. I won't go into the difficulties there have been of setting up this particular piece of research, but I can tell you it's been significant, that those difficulties have been significant. So we're still recruiting into survey 1. And just to remind you then of the link on the slide for anybody who's interested, who lives in the city region, Liverpool City region, to provide data into this household survey. Quickly, just to add that this household survey is also linked to a virology study where colleagues of ours, will be going into houses once a week to take swabs so that they can understand better transmission of the virus. And again, this has a health inequality focus to it, because they'll be recruiting into their study via our own online survey, and because we have be collecting data from people from our neighbourhoods for learning from Clark, then we will have a really good indication, I think, of how disadvantage affects whether or not we contract COVID. So that, in very brief, is what we're trying to achieve in the COVID Live household survey over the next, or over 12 weeks. Thank you.
Hi, thanks very much, Rhiannon. I'm just answering Dorcas's question, who's asking about when people can't respond online, and we've been using, we're doing written invitations where we don't have email addresses that are working, and we've also been telephoning people. But one of the things that we weren't surprised about, but it's nevertheless very important, is despite what's commonly said that everybody has access to the internet these days, we know from tracking back to people who've done our surveys in 2015 and 2018, that certainly isn't the case, and that for many, both the telephone numbers that we had for them and the emails we had for them were no longer working. So particularly residents in more, for want of a better term, deprived communities do struggle to have stable access to both mobile technology and internet. And I think we will continue to keep reminding government and others about the fact that we can't just straightforwardly move to everything being online, because that will significantly exclude important members of our communities, and particularly those who are more vulnerable and frail. So,
yeah, and it's worth just saying that I think we've had about 30 people so far requesting to have this survey over the phone, which is possible. It does work. So if you're interested in that means of providing data, then we can do that. We can facilitate.
Yeah. And indeed, I did actually just type that answer for you. And Cheryl and Kath, I noticed that you're making that connection, so that's great. So thank you very much, Rhiannon. I can't see any other questions for you, so I'm going to move us on to Clarissa Giebel, Dr. Giebel.
Yeah, hi, hi everyone. I'm just going to share my screen with you. So I'm going to be talking about our COVID dementia and aging study. There we go. Okay, so picking up on what Rhiannon was just talking about the household survey. So this is related. It's funded by the same stream as well, and we're doing a mixed method study. So we are interested particularly in how social support service closures as a result of COVID-19 are affecting the lives of older people, so those aged 65 and above, and those that are living with dementia, and those that are currently caring for someone with dementia and that have cared for someone with dementia in the past. And when we talk about social support services, we talk about daycare centres, respite, meals coming into the home, or home carers, support groups as well. So all these services have had to be put on hold, well, most of them. And we wanted to understand how does it affect people by talking to people on the phone. So in April, we spoke to 50 people with dementia and carers about their experiences. And we've just finished last week to speak to 20 people of those again, so about 3 months afterwards. And in this telephone interview study, we found really varied negative experiences and different impacts on people's lives. And particularly now, the 3 months later, many people have had to adapt to how they receive services. So for example, in the home care sector, some people have had to make quite big decisions in terms of, do I want the risk of having home carers coming into the home and possibly bringing COVID to my mother living with dementia or not? Do I now have to pick up all the care? And as a result of that, carers might get more burdened and have higher burnout as well. But there's all these different things. And what we also found in the qualitative work is that people living with dementia appear to deteriorate faster than when they are accessing these support services in the community, because they don't have this social and cognitive stimulation at this point in time. And then we're also running, we're just finishing the third wave of a longitudinal survey. So similar to what Rhiannon was just talking about, it is an online and telephone survey. And the first wave, so 3 waves, the first wave collected data back in April, and we had over 600 older adults, people with dementia, and carers take part. The second wave completed a few weeks ago, so nearly 500 were followed up. And at the moment, we're following up in the third round. And what we want to understand there is really, how does it impact on people's anxiety levels, depression levels, and on their quality of life if they can't get the care anymore that they did receive before the pandemic. So some of those preliminary findings that we've looked at already in wave 1 data is that there do appear to be negative impacts on people's anxiety. So when people don't get the same support anymore after the 23rd of March with lockdown and all these closures, people seem to have higher levels of anxiety and also lower levels of quality of life. But these are just early findings, and the next steps will really be to look at it longitudinally. How does it affect people? And also one thing to mention, so this is UK based, but we are now also working with other countries, including Australia, India, Italy, and Poland. So they're running the same survey, and they're collecting, they're doing the same qualitative interviews as well. Yeah, just a little snapshot.
Thanks. Right, I'm just looking to see if there's any specific questions on your... There's a question about, was the study including homeowners over 60 living with dementia totally reliant on a community care package without immediate family living close by?
I think, so we included people living with dementia of any age, including young onset and including those that lived just by themselves without family carers.
Right. Thank you very much for that. So Clarissa, thanks very much, Clarissa. So now it's Tice, who's going to talk to us about the experience of being a new PhD student in the ARC. Oh, social housing providers is the other question just before we move on. Clarissa, can you address that?
Social housing provider so if you mean in terms of where we recruited from a number of service providers, including daycare centers, House of Memories via their newsletters, etc., and charities across the country.
Thank you very much for that. Okay, Thijs.
Yeah. Okay, so hi everyone. I'm going to give a brief outline of my PhD project, which is going to start in September and will be supervised by Professor Mary Lloyd-Williams, Dr. Clarissa Gabel, and Dr. Siobhan Riley. So through a mixed methods approach, the PhD project seeks to explore the potential facilitators and barriers to engaging with community support in dementia services. So it will be important, as whilst the benefits of people living with dementia engaging in social activities are well documented, everyone may not have equal access, and little is known about the health inequalities in dementia service uptake and whether there are any socioeconomic variations in social prescribing in dementia care. So the objective of the PhDs are to map out the community services in the northwest coast of England and to explore the potential facilitators and barriers in accessing and using these services, and also to understand the effects that non-access may have to people living with dementia, but also their family caregivers, and to finally develop a strategy to potentially overcome the barriers that led to the inequalities in access and use in dementia services. So that was a very quick outline, and thank you for listening.
That certainly was a very quick outline. Thank you very much and welcome. Yes, just to update colleagues, we do actually have almost our full complement of PhD studentships appointed now. There's just Lancaster is, I think it's either end of this week or next week that we're doing some interviews for our Lancaster PhD studentships, and then we'll be moving on in the autumn to our next round of recruitment. So exciting times, and I think we're now up to about 7, 8 appointed and a couple more to come in this current round. So I think that's me now. I seem to have managed to catch up a reasonable amount of time. I can't see any more open questions. Thank you very much, everybody. I think it's fitting that we end on the future by having our PhD student, one of our new PhD students, presenting at the end. This is the future of our academic endeavour. In applied health research and public health and implementation work that we do specialising in the ARC, and it's great to have such a fantastic group of young people so keen to learn about how we work and to join with us in our exciting programs. The slides will be made available to those who've attended the meeting. I can see the numbers are beginning to fall away now as people have to leave. So I won't keep you any longer. I hope this has been worthwhile and that you found it useful and it's helped you catch up with where we are and what we're doing. And hopefully reassured you that we've not been quiet, but we've been very active. We are hoping to meet face-to-face in September for our next ArcFest and are in touch with our current planned venue to see if that's possible and what numbers they'll be able to accommodate. And if that is happening in that venue, that will be up in the north of the patch outside Kendal, a very beautiful spot to meet. So I hope we will be able to celebrate together the work that we've been doing and the work that we're going to be doing going forwards. But we'll continue to keep in touch with you, and thank you very much for attending today. And unless I can see anything else coming there. Oh yes, so Jane's making the point that we also have a joint studentship with the school, NHR School for Public Health. I think that's it. Anybody else want to make any final comments? Thank you, Dorcas. I hope it has been thought-provoking. That was the intention. Okay, well, keep fit and well, everybody, and we will continue to be in touch. Keep an eye on our web pages. We're always updating on our web pages the work that we're doing, and if we're looking for collaborations, etc., and updating on the COVID work that we're doing on there. So many thanks for joining us. It's been great to see so many of you joining us today, and I realise you're all very busy, so I very much appreciate that. Thank you. Keep well, and we'll be in touch. Bye, everybody.